Good morning. I am Pamela Eaton Champion. I will be serving as the MC for the Greater Lansing Area Club of the National Association of Negro Business and Professional Women's Club, Incorporated. This is our fourth GLAC Goes Red, Think Heart, Think Health program. Virtual as it may be, just think, before the COVID-19 pandemic, heart disease and diabetes accounted for more deaths in the US and worldwide than everything else combined. We would like to express our thanks to all the frontline and essential workers who have tirelessly and bravely continued to do their jobs beyond the call of duty just for nearly a year. We also wish to express our sincere condolences to those who have lost loved ones. Health is one of GLAC's program components. Therefore, we are pleased to host GLAC Goes Red, Think Heart during American Heart Month. This gives us an opportunity to have a heart-to-heart talk with the community about a disease that with healthy and wise choices can be preventable and controllable. Knowledge is power, and we want to empower you with the facts that can lead to a long and healthy life. Before I bring you Gloria Davis, president of the Greater Lansing Area Club, who will officially welcome you this morning, I ask that everyone joining us to hashtag GLAC Goes Red and wear red for women to your social media. You can even post a picture in red. Thank you so much.
Good morning. As president of the Greater Lansing Area Club of the National Association of Negro Business and Professional Women's Club, Inc., we are very pleased to welcome you to the Greater Lansing Area Club Goes Red. Think Heart, Think Health program. We encourage you to continue to make healthy heart choices. At this time, I present to you the Greater Lansing Area Club members. Now, without these ladies, this program would not have been made possible. We want to thank and acknowledge the Think Heart, Think Health Committee. A special thank you to our sponsors. Your unwavering support have helped to make this celebration a success, and we truly value and appreciate the support you have provided for our program today. Lansing Area Black Nurses Association, McLaren of Greater Lansing, Lansing Community College, Lansing Board of Water and Light, and AARP of Michigan. Thank you. And now you're back in the hands of our MC.
Oh, okay. At this time, we are pleased to have our own Dr. Saray Eaton to present AARP and Loretta Osborne of Lansing Community College.
Good morning, GLAC members and guests. I'm Loretta Osborne from the Health and Human Services Division at Lansing Community College, and we are honored to be part of your event today. I'm pleased to introduce Nicole Grusbeck, who is one of our kinesiology and fitness professors. Professor Grusbeck is an ACE certified health coach and behavior change specialist, and she has a presentation for you today on cardiac health. We also have a handout of exercises for your membership that you can do on a daily basis. Enjoy the presentation.
Hi there, my name is Nikki Grusbeck, and I am one of the full-time faculty in the Physical Fitness and Wellness program at Lansing Community College. And I'm really excited to talk to you guys today for just a few minutes about exercise and heart health. For the past 22 years, I've been able to teach a class at Lansing Community College called Healthy Lifestyles, which is a class that gives an overview of how to decrease our disease risk, particularly heart disease and cancer, by maintaining a healthy lifestyle. And that includes exercising, eating healthy, maintaining a healthy body composition, managing our stress. All of these things are packaged together and they result in a lot of controllable impact that we have over decreasing our risk of developing heart disease. There's a quote that I really like. You see it on your screen here. It says, if exercise were packaged in a pill, it would be the single most widely prescribed and beneficial medication in the nation. And it's true. Exercise truly is the best thing that we can do for our health. Our heart is a muscle, and like any muscle, it has to be overloaded and worked if we want it to get stronger. One of the things that we know through this initiative called Exercise is Medicine is that exercise done regularly can do more to improve our health than just about any other prescription that we can receive. So usually the question is, what should I do and how much is enough? Well, the American Heart Association recommends that we do about 150 minutes of exercise per week. And our main focus, while a good exercise program includes some cardiovascular exercise, some strength training, and flexibility, for heart health, our focus really is on that cardiovascular piece. We want to be doing somewhere between 20 to 30 minutes per day, and we want to be working at about a moderate intensity. So that means your heart rate's elevated a little bit. Maybe you're breaking into a sweat. Maybe you notice it's a little bit more difficult to talk or carry on a leisurely conversation. That's really the intensity that we want to get to. And the more we've studied this, we know that that doesn't have to be done in one block of time. Sometimes people say, well, I don't have 30 minutes to do an exercise session. You can break it into 10-minute sessions. And I think it's particularly important for us to be aware of this right now, especially during COVID, when many of us are working from home. And a lot of people are not able to go to a gym or don't feel comfortable going to a gym just yet. We need to get creative and find things that we can do at home. There is this notion now, this new 21st century, what we call sitting disease, where we know that Americans are sitting way too much. We're sitting in front of computer screens, just as you're viewing me now. And we know that that can significantly increase our risk of heart disease. So a good goal is to set a timer, get up, walk every hour. Okay, if you're sitting at your desk, if you're working at home, we should be getting up and moving every hour for at least a few minutes, and try to do 2 or 3 or 4 10-minute exercise breaks in your day. And that might just mean going up and down the stairs in your home, doing a few laps around the house. As the weather gets nicer, make sure that you're taking advantage and going outside and getting some fresh air to do that physical activity. But the more we move, the stronger and healthier our heart will be. Additionally, it's really important that we pay attention to not only our exercise, but also the food that we're eating and the way that we're managing our stress. A couple quick tips just to make sure that you're getting plenty of fruits and vegetables and whole grains in your diet to provide the antioxidants and immunity boost that we all can use right now as we're trying to stay healthy. And managing your stress well. Self-care is so vital. We need to take time to take care of ourselves, to take care of our health, to take care of our hearts. That means that we should be getting some daily, regular exercise, that we need to be getting enough sleep. We're managing our stress well with some positive outlets, that we have a good social support network, and that we're eating in a way that's fueling our body well and keeping us healthy. So I'm going to leave you with a handout. I think we can send that to you electronically with some good at-home workday tips, things that you can do at your desk and around the house to get a little more physical activity in. And I am here to help. I would love to hear from you if you have any questions. Again, my name is Nikki, and I'm with the Physical Fitness and Wellness Program at LCC. Thanks for giving me an opportunity to talk with you guys today. Have a great one. Bye.
AARP has been a proud sponsor of this program for a number of years, and they will continue to be. And I just wanted to say that we are looking forward to this presentation and being able to see all of you become healthier individuals. Thank you.
Sometimes we can be all over the place for everyone else. We bring you a video today, Just a Little Heart Attack by the American Heart Association.
It started out like a totally normal day.
Mom!
Okay, move objection deadline to the third line after survey. Oh, honey, for when you learn, always use the verb MedStar. What are you doing down there? Did you finish your breakfast?
Ow.
Whew. Don't hit your brother. Honey, you have to eat something. Here. Okay, 5 minutes to carpool. Where's my coffee?
You okay, Mom?
Oh, I'm fine. Sandwich orders. What do you want?
Almond butter and jelly.
Spaghetti.
Oh, you sure you're okay?
I'm fine, sweetie.
I am so late. Hey, buddy, how you doing? Hey, honey. You okay?
Yeah, I'm fine.
You sure?
Oh, yeah. Here.
Acai, my favorite. See you guys later.
Wear your shoes. Put your shoes back on, please. You know, go help your sister. We're going in 3 minutes. Oh my God, what am I doing? I forgot to cut off the crust. Voila. Shoes on, potty if you need it. Honey, get your sister. Okay, get her shoes. Nobody move. I'm getting a dustpan. Oh.
Mom! I think you're having a heart attack.
Honey, do I look like the type of person who has a heart attack? Just gonna sit down. I'm totally fine. Don't forget to wear the high socks with the shin guards.
Forget about the shin guards, Mom.
Come on, Mrs. Underdog is not gonna wait. Whoa. Okay. 9. Hi, sorry to bother you. I think I might be having a little heart attack. Nothing really, just some nausea, tightening of the jaw, dizziness, shortness of breath, muscle pain, achiness, this terrible pressure in my chest. Oh, really? They can be here in how long? 2 minutes. Can you make it 10? I thought I had gas. Turns out I was having a heart attack. Heart disease is the #1 killer of American women. So now I take care of my heart and I tell the women in my life to do the same.
Sounds great, by the way.
That's nice, sweetie, but that's not my heart. That is. Make it your mission to save your life and the lives of the women you love. Find out more from the American Heart Association at goredforwomen.org.
Thanks to actress Elizabeth Banks, who states that while the film is funny, having a heart attack is not something to be laughed at. However, she is using humor to help uncover the truth about heart disease and to get people interested in learning more about their hearts. Checking your blood pressure at home is an important part of managing high blood pressure. The Lansing Area Black Nurses Association will demonstrate how to make your blood pressure or how to take your blood pressure with accuracy. Following the demonstration, our own Dr. Saray Eaton will introduce our keynote speaker.
The American Heart Association recommends home monitoring for all people with high blood pressure to help the healthcare provider determine whether the treatments are working. Home monitoring self-measured blood pressure is not a substitute for regular visits to your healthcare provider. This video is an informational conversation on how to take a blood pressure.
Hi, sister. Hello, sis. How are you? I'm doing fine. Can you show me how to check my blood pressure? I want to make sure that I'm taking it right. Of course, but not yet. I have some questions for you. Yes, Sister Nurse. I love when you call me that. Did you take your blood pressure medication this morning? No, not yet. Okay, so have you had anything to eat, any caffeinated drinks, or did you exercise within the last 30 minutes? No, but I did finish my exercise class about an hour ago, and I was hoping you would fix me something to eat. Oh, great.
The American Heart Association recommend that you don't smoke, drink caffeinated beverages, or exercise within 30 minutes before measuring your blood pressure. Empty your bladder and ensure at least 5 minutes of quiet rest before measurement.
How often are you checking your blood pressure? I've been tracking my blood pressure twice a day at the same time of the day. Okay, that seems right. I track my blood pressure readings on the app that I found on my phone. They have apps for both Apple and Android. I also printed this form I found off the American Heart Association's website. It helps me track my blood pressure readings.
Okay, so how have your blood pressure been running?
About 125/71. Okay. What if my blood pressure suddenly exceeds 180/120?
A single high reading is not an immediate cause for alarm. However, if you get a reading that is slightly or moderately higher than normal, take your blood pressure a few more times, write down your readings, and consult your healthcare provider.
If your blood pressure is higher than 180/120 and you are experiencing chest pain, shortness of breath, back pain, numbness, weakness, change in vision, difficulty speaking, do not wait to see if your pressure comes down on its own. Call 911.
Is that why you want me to show you how to take your blood pressure?
Yes, sister. Okay, so now I know how to track my blood pressure.
Okay.
And know how to identify when the numbers are elevated. But what exactly is a blood pressure?
I want you to open and close your hand to the sound of the heartbeat.
The force of blood on artery walls is called blood pressure. Normal pressure is important for proper flow of blood from the heart to the body's organs and tissues. Imagine that your hand is your heart. As you close your hand, blood pressure measures as the heart contracts, which is called systolic or the top number. As you open your hand, blood pressure measures as the heart relaxes, which is called diastolic or the bottom number.
Okay, that makes sense. I'm now ready for you to show me how to take my blood pressure.
Okay, let's go wash our hands and get set up. What blood pressure cuff are you using?
In doing my research, I chose what the American Heart Association recommends, an automatic cuff-style bicep upper arm monitor. It also states wrist and finger monitors are not recommended because they yield less reliable readings.
Sit correctly. Sit with your back straight and supported. A dining chair or kitchen chair can be used. Your feet should be flat on the floor and should be supported on a flat surface such as a table, with the upper arm at heart level. The bottom of the cuff is placed directly above the bend of the elbow. Check your monitor's instructions for illustrations or have
have your healthcare provider show you how. Do not measure blood pressure over your clothes. In 5 minutes, I'll come back. Don't fall asleep. It has been 5 minutes. Go ahead and push start. So, what did you learn?
I took some notes. Can I read them?
Yes!
So, I learned to be still, don't smoke, don't drink caffeinated beverages, no exercise within 30 minutes of taking your blood pressure, sit quietly for 5 minutes, sit with your back straight up and your legs uncrossed, measure at the same time every day, and take multiple readings and record the results.
Excellent. The only thing that I would add in there, sis, is that when you apply the blood pressure cuff, you want to make sure that it fits appropriately, and you want to make sure that it's at above the bend of the elbow.
Okay, got it.
If you have any questions regarding this video on how to take your blood pressure, track your blood pressure at home, please visit the site right below at American Heart Association. GALC is going red. We need to log into Think Heart,
Think Health 2021 to hear great conversations about heart disease awareness.
Thank you. Thank you to the Lansing Area Black Nurses Association for that great video. It is my pleasure to introduce our keynote speaker today, Dr. Patricia Davidson. She is a medical internist and a cardiologist who has a private practice in Washington, D.C. Dr. Davis attended the University of Michigan, so she does have Michigan ties. With a BS in psychology, she went on to get her master's degree in chemistry from Atlanta University, and she graduated as the third woman of color in 100 years from the University of Louisville Medical School in 1978. She's a diplomat of the American Board of Internal Medicine and a fellow of the American College of Physicians. Dr. Davidson served on the faculty at the University of Maryland Medical School in the Division of Hypertension and Cardiology. She was an instructor of medicine at Howard University Medical School, and she served as a master faculty member for Women and Heart Disease for the American Medical Women's Association. And I'm not done. She has regularly appeared on radio, television, and in print media on health and heart disease. She's been on Tony Brown's Journal, CNN, BET, and local and national television networks. She's a very popular speaker among national and local organizations on the topic that's her greatest passion, which is heart disease in women, African Americans, and other ethnic populations. She also aided the Honorable Congresswoman Maxine Waters in the preparation of her amendment to the Women's Health Research and Prevention Act. Dr. Davidson was cited in the Congressional Record upon passage of the bill. She was also selected as the first inductee into the Washington, D.C. Hall of Fame in the area of health, and that was in 2000. Dr. Davidson is a wife and mother of a daughter who's an engineer. And in her practice, she stresses preventive cardiology, which includes weight reduction, smoking cessation, hypertension, detection and control, cholesterol lowering, and exercise. She encourages a positive change in lifestyle to embody health and longevity. So again, it is my pleasure to introduce Dr. Patricia Davidson as our speaker today. Thank you.
Good morning. And I am sorry I can't be in Michigan. I have been there many, many times. I think I spoke yearly at LCC for many years and other organizations that were in the Lansing area. So I'm glad to be with you again. I don't have anything different to say from all those years, but what I've learned over the decades is that the message is the same, but unfortunately, most people haven't heard it. So I'm going to say the same message over and over again. And during Heart Month, I have found when I ask my patients, do they remember what we talk about know your numbers? They say, no, they never heard of it. So I guess we haven't been too good about delivering our message. So I hope today that many of you in this audience today will hear the message and recognize that heart disease is the most preventable of all diseases. And if you have heart disease, it's primarily because of the lifestyle that you've chosen. So we're going to spend today trying to make sure you choose a lifestyle that doesn't lead to heart disease. So atherosclerosis or arterial sclerosis is the hardening of the arteries, and that's the primary killer of all Americans and all ethnic groups and genders. And what causes that is that these are two tiny little arteries called the coronary arteries. There's a right and a left, and they are the size of a pencil tip. And you have to keep something the size of a pencil tip open for the rest of your life. It is not a natural process that you should clog these arteries, because clearly thousands of years ago, people didn't die from all of these heart attacks. So you have to keep something the size of a pencil tip open for the rest of your life. And this is what it should look like when you're born, and gradually plaque begins to fill up and becomes calcified and hard to the point where you get symptoms, or before it becomes calcified, it can actually rupture and cause a heart attack or a stroke. Now, the artery wall is a muscle, and inside of that muscle, we have numerous enzymes and hormones with 10-syllable words. There are good ones and there are bad ones. When you are doing things that are good for your life, like walking, meditating, yoga, praying, you end up having the good hormones released, which prevent the formation of plaque. And when you're doing things that are not good for you, like fighting and angry and stressed out, and smoking and having all kinds of terrible risk factors, then the artery wall begins to fill with plaque. And so depending upon the lifestyle that your parents are leading, because you as an infant and a toddler don't pick your lifestyle, your parents pick your lifestyle, the plaque begins to form. And then more plaque begins to form depending upon the lifestyle you lead. And all you need is for something very traumatic to happen to you. I always like to use an example of your 15-year-old son taking your Mercedes and driving it into a brick wall, and you hear about it and you're about to have an increase in your Geico, then all of a sudden your artery ends up squeezing at this very point, and the plaque ruptures and goes into the artery wall. This particular artery wall has not been filled with blood. It's only partially filled with blood. So as a result, we have something called an acute coronary syndrome, or if it's in the brain, we have something called a TIA, a transient ischemic attack. If it totally closes off the artery, it's called a heart attack or a stroke. So atherosclerosis is preventable. It's not a natural process of aging, and it's reversible. Now, this is very important. Preventable, and it is not natural. It is based on the lifestyle you've chosen, and it is reversible. The onset is in the fetal state if your mother has a high cholesterol when she's carrying you. Otherwise, it begins in the first decade of life. Now, erectile dysfunction is one of the first signs that the artery wall has become dysfunctional in men, and that comes from atherosclerosis. So the arteries that lead down to the pelvic region are the same size as the arteries in the heart. They're very small, so that a lot of people don't realize that when you hear all of those commercials on TV for erectile dysfunction medicine, then that's really the first sign that your arteries are beginning to clog. So they're beginning to clog in the pelvic region as well as in the heart. Now, what we learned several decades ago, which we didn't know for many years, is that it is not the rock hard plaque that fills up the artery wall with calcium that causes symptoms that's going to cause your heart attack. It is what we call the vulnerable plaque, the new plaque that is just beginning to form, that's still very, very soft, like a piece of soft fat that's going to end up rupturing. And so that people say, why did I have a totally normal workup, or my mother had a totally negative workup from the cardiologist and then she had a heart attack the next week? This is because if you put a dye in this artery here, it's going to be nice and big and open. If you do a stress test, it's going to be normal. So all of your tests are going to be normal, and you will not be able to pick up this very soft plaque that can cause the heart attack. So that's why you can have normal studies. You can only have an abnormal study if you have significant plaque clogging your artery. So a heart attack is a bruise on the muscle wall as well as a stroke. It's an actual bruise, and you've lost actual muscle. And muscle within the heart and the brain are very important. So any part of those very small organs that are lost, then you end up having significant disability. And so it's called an MI, or for short, or a myocardial infarction, in which the artery is totally closed. Now that's different from congestive heart failure. That is the failure of the heart to effectively pump blood to the organs and back again. So people confuse those two. The major cause of congestive heart failure in African Americans is uncontrolled blood pressure, and the major cause in the majority of the population is coronary artery disease and heart attacks, where you have damaged muscle. What happens is the heart has to have every single piece of its muscle functioning effectively. So with every heartbeat, the blood goes up to the top of your head and down to the bottom of your toes and then gets recirculated. If it can't do that because the heart muscle is too thick because of uncontrolled blood pressure, or it's large and flabby and not functioning properly because of a heart attack, then the blood stays down in the legs, it stays down in the abdomen, and it stays into the lungs, and you become congested. And so that is different from a heart attack. And this also happens to be the major cause of hospitalizations in this country. So who is at risk of having clogged arteries? If you eat animals every day, you are not going to be able to have normal arteries. If your body mass index is over 25, that's your weight, then you won't have normal arteries. If your LDL bad cholesterol is over 100, you're not going to have normal arteries. If your systolic blood pressure, that's the top blood pressure, is over 120, you can't have normal arteries. If your fasting blood sugar is over 100, you can't have normal arteries. If you don't exercise, which releases all those great things like endorphins that help keep the artery wall open, you can't have normal arteries. If you smoke, which is our worst risk factor, nicotine just tears up the artery wall. And if you have any inflammatory processes like poor oral hygiene, arthritis, or any chronic infections like prostatitis and lupus, pelvic inflammatory disease, you won't have normal arteries because you're releasing all kinds of really bad inflammatory hormones and enzymes. So most of you look at this list, and if you have any of these risk factors, you know that you don't have normal arteries. And just about everything on this list is preventable and reversible. So now that everybody has the same disease, but everybody doesn't have the same death rate. So African American women have the highest mortality rate from heart disease. White women are probably next, but Latino and Native American women are undercounted. So these numbers are definitely not accurate, especially among certain Latino populations. And the Latino population is not homogeneous. Mexican Americans have the same risk factors that African Americans have and have the same death rate from that. Cuban Americans are much healthier, and Puerto Rican Americans, and they may have a lower death rate. But again, they're not counted because we don't divide up the population like that. Native Americans are probably not counted unless there is something about them that lets people know that they're Native American. Now, the statistic that is accurate is Asian Americans. Asian American women have the lowest rate of everything in this country. And that's because they are the healthiest people in the country. And that's primarily because they stay thin and they don't smoke. And so this is where I like to remind people that there are 3 things that you can do in your life to prevent over 80% of the diseases that kill us. And that's stay thin, not smoke, and walk. I don't know if Asian women walk or not, but they definitely stay thin and they don't smoke. And that's all they had to do to have the lowest rate of all diseases in this country. Now, Asian men do smoke, so therefore their rates are much higher, as well as all other men of color. White men have the lowest death rate because they are the ones that we did all the studies on. They are the ones that listen to the preventive measures. They are the ones that are treated the most aggressively and prevented and treated after they do get the disease. Now, all of you are concerned about COVID and whether it has an effect on the heart. It most definitely does. There are multiple heart attacks that can take place when you have a COVID infection. That's due to a whole lot of small blood clots that take place all up and down the coronary arteries, which is very unlike the cholesterol plaque that ruptures. You can also find congestive heart failure due to a weakened heart muscle, and we call that a cardiomyopathy. So after you have a very severe infection and we do a sonogram on your heart, we find out that it's very weak. You can have blood clots in the legs that can travel to the lungs, and you can also have abnormal heart rhythms as atrial fibrillation. So these are some of the things that we're finding out. How you can prevent COVID, obviously by doing all the things that you've been told to do over the last couple of years, which nobody seems to be paying attention to in certain states. But in terms of things that you personally can do, vitamin D deficiency is associated with worse outcomes. So if anybody lives in a place that has winter, which you all are living in, you should be on vitamin D. Everybody should have their vitamin D tested because it is an immune vitamin. And I've been saying that for years. And so we keep doing studies saying that vitamin D doesn't prevent heart attacks, strokes, or cancer, but it's not supposed to do that. It's an immune vitamin. So we know it plays a strong role in preventing osteoporosis. It plays a strong role now in preventing COVID and other autoimmune disorders. So you should have your vitamin D checked, and that should be treated. And if it's very low, you have to be given very high dose vitamin D to get it under control. If it's only a little bit down, then you should be on over-the-counter vitamin D. I tell people should be at least 2,000 international units of vitamin D3. So make sure that your doctor is checking that. And obesity is strongly associated with a greater need for ventilator use and death. So usually the people that end up in the hospital are going to be the obese, and they're usually found out to be vitamin D deficient as well. The only patients of mine that have ended up hospitalized are those who were obese. Let's talk about risk factors. Those are the things that cause your artery to clog, and those are the things that you control. Blood pressure, I make it very simple. We have several classifications, but the only one you need to know about is 120/80. That's what your blood pressure should be. And you're probably going to ask me about studies that you heard about in the news media about how it's possible you could be 140 and it's okay to be 150. That is not true. The SPRINT study, which was done recently by the NIH, dispelled all of those myths that have been going on for the last decade. So that if you look at people who are 120 and less, they have a 1/3 reduction in heart attack, stroke, and heart failure, and a reduced death of 25%. So that's the blood pressure that you want to be. And if you are above that, you are forming plaque in your arteries, and you're also subjecting yourself to congestive heart failure. Every pound you lose, you drop 2 millimeters of mercury. So if you drop 5 pounds, you will drop your blood pressure 10 millimeters of mercury. So when somebody says that you have borderline or pre-hypertension, it just means that we know that in a very short period of time, you could lower your blood pressure. And so we don't put everybody on medicine just because they're over 120. If they're 130, we would not put you on medicine. Probably wouldn't put you on medicine until you got up to over 140. But that doesn't mean that you are not forming plaque during that time and that you're not damaging your heart muscle. And you may have heard about the DASH diet that was studied many years ago from the NIH. And it's just a simple diet rich in fruit, vegetables, low-fat dairy, and low salt. And you can substantially lower your blood pressure just by doing some of those things. And salt is for snow and for sore throats. No one should be putting a salt shaker on their table because all they are doing is allowing their children and the rest of their family to develop high blood pressure. Salt is sodium chloride. It is a chemical. It doesn't matter where it comes from, whether it comes from the sea, whether it comes from a mine, whether it comes from the Himalayan mountains. If you really believe people climb the Himalayan mountains and bring down bags of salt, whether it's kosher, whether it's Christian, it is all sodium chloride. And it ends up causing a reaction in your kidneys that causes a particular hormone to end up causing constriction of your arteries. So it is the same no matter where it comes from, no matter what it looks like. So that is what you do not want to be adding extra to your food when you're cooking and you're at the table. Sodium chloride is in all of the food that we eat. The food industry has introduced that to us because it ends up making the food more palatable, and it also makes it very addicting. So salt is one of the substances that make something very addicting. Think about the Lay's potato chips. When they say you can't eat just one, that's really true because of all the fat and the salt on it. Now they do have potato chips that are baked without salt, and probably many of you can eat just one. So foods that lower blood pressure. Nitrate-rich foods like beets, arugula, spinach, celery, and parsley are examples. High potassium foods like beans, navy black, soya, pinto, and lima beans. Polyphenols such as blueberries, nuts, green tea, extra virgin oil, legumes are all things that may lower your blood pressure. But most importantly, hibiscus tea. So I tell my patients, drink hibiscus tea, not with sugar though, but just drink hibiscus tea, and that can lower your blood pressure if you're just borderline. And flaxseed also does that. Now, what is the role of obesity, especially central obesity in the stomach area that so many of us get, especially as we age? It leads to insulin resistance. And so because this fat is all around our organs, especially around the pancreas, we know that it ends up causing us to develop diabetes. And we have something called the pre-diabetic state. Many of you may say that you were told you had pre-diabetes. Well, the proper term is metabolic syndrome. It is just as destructive as diabetes. So if your sugar is above 100, you're still forming plaque. So just because somebody tells you that you don't need medicine right now because your sugar may not be high enough, and we don't treat every slightly elevated sugar, we give you a chance to change your lifestyle in order to reverse it. But it doesn't mean you're not forming plaque during the time that your sugar is over 100. And so if your waist size is over, if you're a woman of color, is over 31, European women can be up to 35, men of color 37 inches, European men 40 inches. This means that this whole myth that we're supposed to be heavier because we're bigger boned than Europeans is a myth, because we will develop diabetes and other diseases at a lower body mass index and a lower waist size. So when your waist starts to become 31 and a half, you're going to end up developing diabetes way before that of the European woman. So waist size is very critical because that fat is going around your organs. Now you're going to probably ask me about liposuction. No, that will not solve the problem because the liposuction is just underneath the skin surface, and the fat that we're talking about is way deep into the organs and all around the organs. So liposuction will not solve that problem. They've already done that study. And if your fasting blood sugar is over 100 and your blood pressure and your cholesterol elevated, you have that pre-diabetic or metabolic syndrome state, which is just as destructive as being called diabetic. Diabetics cannot have normal arteries. So by the time you're diagnosed officially with diabetes, you've spent probably a decade or more with elevated sugars and probably elevated weight and elevated increased waist size with that fat around your pancreas, and you are already developing coronary artery disease by the time you're diagnosed. And we call that a coronary artery disease equivalent. And so cholesterol is critical in the diabetic. Bad cholesterol should be technically optimally under 70 for a diabetic or somebody with heart disease. But since diabetics basically do have all heart disease, then we know that you should probably be under 70. And all diabetics should be on a statin, no matter what their cholesterol level is, because we know that you cannot have normal arteries if you are diabetic. And if you can get your LDL to under 70, you can actually have reversal of the plaque in your arteries. And powdery white substances, sugar and salt, were grown and mined by us as our ancestors as slaves, and now we are the slaves to these additives, which are definitely deadlier than that of cocaine. And who is overweight in this country? If your body mass index is over 25, you're basically going to die from your weight. And who is overweight? Well, before I get to that, let's talk about the complications of weight. When you are overweight, you have increased stroke, coronary heart disease, diabetes, hypertension, gallbladder disease, arthritis, gout, deep vein thrombosis, venous stasis, cancer of the breast, colon, uterus, pancreas, kidney, prostate, sleep apnea, fatty liver, and reproductive abnormalities like polycystic ovarian disease, infertility, and abnormal menses. When you are obese, the heart is involved and you actually have structural changes. The top chamber, the atrium, can become dilated, and that can lead you to an increase in atrial fibrillation. That's that rhythm that you hear about on TV for the commercials for blood thinners, because when your heart is beating or fibrillating at an abnormal rate, you end up forming blood clots in your heart, and you end up having to be on a blood thinner to prevent a stroke. Also, the bottom chamber, the left ventricle, becomes thickened, and that's what can lead you to congestive heart failure. So fat is a metabolically active tissue that attacks every organ in your body. And who is overweight in this country? African American women and Mexican American women are the most overweight. Asian women are the thinnest in America, and that means that they will have the least amount of all diseases, and white women are close to 50% overweight. And this is what we have to watch out for. The full figure revolution. If you've got it, flaunt it. So, and we now have a new term about fat shaming and all of this. So what we've done is we have, especially our young women, we have begun to accept the overweight status, but we're also accepting the highest rate of heart disease in the country. Now, prevention. Can you turn back the disease? Yes, you can. So if you walk 30 minutes a day, you have a 50% reduction in heart attack, stroke, and cancer. And when you try to prevent heart disease, you're also preventing cancer. So all the things you do for that, you also prevent cancer as well, especially of the breast. And the more you exercise, the greater the reduction is of coronary heart disease. And nutrition, you are what you eat. So let's talk about that. The cholesterol you need to know about is the LDL, or the bad cholesterol. You don't need to worry about the total cholesterol. And by the way, the total cholesterol is not a total of the triglycerides, the HDL, and the LDL that you see on your lab slip. So it has less meaning now that we know that we can break it up. And we used to say it was okay for us to be at 130 or even 160 in the past. And that's because the studies that we did with the earlier cholesterol drugs could only get us down to the 130 range. And we thought that we did better if we were down there. But then we did more studies with stronger drugs, and we found out that if you were under 100, you did better than if you were 130. And then we found out that if you got to under 70, you could actually have a trend towards reversing your cholesterol plaque. So if anybody has been diagnosed with actually having heart disease, and that could be in any way, you could get a mammogram, and the radiologist has to report calcium plaque anywhere they see it. And your artery begins to calcify, or the cholesterol plaque begins to calcify. So if you do a CAT scan, you can see calcium plaque all over your body. So if you see it in the coronary arteries or in the aorta when you're having a CAT scan or a mammogram, the radiologist will report that. And that means that you already have started to form coronary artery disease. So if you have plaque anywhere, or if you have an equivalent disease like diabetes, then you should be under 70, because you want to be trying to reverse the actual plaque. No one should be over 100. Now, where does cholesterol come from? Every living cell is made up of cholesterol, and it only comes from animals. And so you can have a genetic defect, and you won't be able to metabolize your cholesterol properly. But we are animals, and we have cholesterol in our liver, and our liver has to metabolize the cholesterol. And if we have enough enzymes, it will be able to do that. And so when you have a certain amount of enzymes, your liver is made for your cholesterol. And when you dump too many animals onto your liver and too much cholesterol, then you can't end up having enough metabolized. And so when you get your cholesterol done and you see that your LDL is over 100, you know that your liver basically is saying, I'm on strike. I've had enough cholesterol. I've done what I'm supposed to do because I've metabolized your cholesterol. I can't metabolize the pig and the fish and the chicken and the cow and everybody else's. All right. So that's how you find out whether you're going to have plaque in your arteries. you see how effective your liver is at metabolizing your cholesterol. Now, let's look at how we change cholesterol. Statins are the drug that we have been using. And we have many different effects. We have a whole lot of different enzymes with 10-syllable words that end up causing us to have bad effects on our artery wall. And then we have good things that end up doing the opposite. And so statins have been shown to be life-saving for that very reason, because they end up getting rid of all of these horrible things that are in our artery wall. And so they are life-saving. Now, there's a whole campaign against statins, which you can hear anytime you go on the internet. Statins have been shown to reverse plaque. They have been shown to prevent heart attacks and strokes. They have been shown to reduce dementia because we clog up the arteries to our brain. And so all of those kinds of things have been shown to be effective. So statins do not have deadly side effects. Somebody told me the other day they don't want to die from a statin. There is no you do not die from a statin. If you have side effects like muscle aches, or if you have some change in your liver because you're supposed to be checking your liver enzymes when you're on a statin, then all of that is reversible when you stop the statin. So the side effects of statins are reversible, but the side effects of heart attacks and strokes are not. Protein sources. Beans, such as the soya bean and tofu or any other beans, are a protein source. Animals, of course, are a protein source, like meat and dairy, and you should be picking the animal with the lowest cholesterol, which is fish and poultry without the skin. And you cannot eat an animal every time you eat and have arteries free of cholesterol, because your liver cannot handle that much cholesterol. Color code your food. Green food is lowest in sugar, highest in nutrients. Red, yellow, and orange food is high in sugar, but high in nutrients. So if you are overweight or have a high sugar, you cannot eat all the corn and the carrots and the beets and the sweet potatoes that you would like to eat because of the amount of sugar, even though they're very high in nutrients. White food is refined, high in sugar, and low in nutrients. You should not be eating any white food because all of the nutrients have been removed and you're basically just eating sugar. So a bowl of white rice is a bowl of sugar. A piece of white bread is just basically a stick of sugar. You're eating the sugar cane. And somebody's going to ask me about cauliflower, and cauliflower is not white, it's beige, so it doesn't fit into that. It hasn't been refined. So your focus should always be on having a lot of green carbohydrates in your diet and trying to reduce the others as soon as you can. And foods that reduce your risk of cardiovascular risk are nuts, 5 or more servings a week, 14% lower risk of cardiovascular disease, 20% lower risk of coronary artery disease. Red meat increases your risk of all-cause mortality from cancer and heart disease. Fried potatoes, potato chips, hash browns, two to three times a week increase your mortality. Now, what is the difference between how people present? Chest pain is the number one symptom that everybody will have, men or women. But back pain, shortness of breath, nausea, and fatigue can also play a major role, especially in the female population. And a lot of that is that we end up not having chest pain because we probably don't exercise to the point where we have chest pain. African American girls stop exercising by the ninth grade. So we are the least likely to do regular exercise. So fatigue is a very important symptom, as well as shortness of breath, and that will happen long before you get to the point of having chest pain. And I always like to give people the example that if you no longer want to shop at your favorite department store and you can't do any more housework and you don't feel like going out anymore, then you most likely, that is the fatigue and the shortness of breath that comes from clogged arteries. And you need to have that studied. And you need to make sure that you're finding a doctor that takes you seriously enough to understand that is a cardiac symptom, not just chest discomfort. And racial and gender bias with referrals. So let's talk about what you're least likely to be referred for. And that's an angioplasty. So we can thread a catheter up through our leg or through the arm all the way up into the coronary artery. And an angiogram is when we just put dye into the arteries to actually see these two arteries. These arteries cannot be seen with a sonogram. The only way you can see these arteries, because they are embedded in the muscle wall, is by putting dye in them and having some form of radiation. And if you actually have significant clogs, you have to go down into the artery, raise up a balloon, and smash open that cholesterol plaque. And I use the word smash because when you smash something, you know you also have scar tissue. So it's not a panacea. So when you smash it open, you put a little wire mesh in called a stent, and then that tries to keep the artery wall open. And after that, you have to use all kinds of drugs to keep two types of drugs at least to keep it from clotting. And you have to be on a high dose statin, and you have to have controlled sugar and controlled blood pressure in order to keep that artery from closing back. So people say, oh, I'll just get a stent. Well, it's not that easy, because if you stop any of those drugs abruptly, you can have acute closure of that artery and an acute heart attack. If you have too many arteries, who should get an angioplasty? The first important thing is that you need to be symptomatic. And so the reason for that is that angioplasties do not prevent death and heart attack. They only prevent symptoms. That's a very important thing. And so now we used to open up every artery that we saw with any cholesterol plaque in it. We no longer do that. The artery has to be over 70% closed for us to do it. And the reason for that is that we now know that optimal medical therapy, meaning getting your cholesterol to under 70 to reverse the plaque, controlling your sugar and your blood pressure, will reverse the plaque. And so we will do that first before we take you for an angioplasty. So the less significantly closed arteries will be treated with medical therapy. And so that's something that you need to be aware of. And so that you need them, and a good hospital with a good system that actually monitors what doctors are doing are going to make sure that doctors are not opening up arteries that are not 70% closed. And if you have too many clogged arteries, then you have to have bypass surgery from a vein that's brought up from the leg, and it bypasses the clogs, or from the arteries in the chest wall, and your arteries brought down to bypass the clogs if you have too many arteries that are clogged and not just one or two. And who's going to get these procedures? There's been many studies. This is the one I think is the most important. There's a Disparity Solution Center at Harvard, and they gave clinical vignettes to their residents in their hospitals. And so we're talking about very young people, and we're talking about very recently. So that these are not, this is not dated back from decades ago. So this is what I like to say, these are the grandchildren of Jim Crow. And they took a questionnaire, and lo and behold, they found out that they would treat the African American, in particular the African American female patient, less aggressively with the exact same diagnosis of a heart attack. And so there definitely is an unconscious bias that contributes to racial and ethnic disparities in the use of medical procedures and treatment in this country. You are looking at a lethal weapon, and the fact is that more Americans die by the fork than any other weapon, and that's because so many of them use it irresponsibly, fill it up with high-fat, high-cholesterol foods that load up your blood with cholesterol, that clog up your arteries, leading you to an increased risk of heart attack and stroke. So the next time you pick up a fork, remember to handle it as you would any other weapon, for self-defense and not self-destruction. Thank you.
Thank you so much, Dr. Davidson. A lot of information, a lot of good information to literally take to heart, right? And following this presentation, we're having a question and answer period. So we would like for those of you who have questions regarding this presentation to type it in the chat, and we will be able to ask Dr. Davidson. We do have a question from Laura Baltimore. She wants to know if we should first check with our physician before starting vitamin D, or can we start with a low dose?
Well, what you buy over the counter will be a low dose. So you're going to have 1,000, 2,000 international units. And preferably a gel cap because it's easy to swallow and it's in liquid form, and preferably with food because it's a very hard vitamin to actually absorb. So you prefer, you may have it in a multivitamin or with calcium, but you really want it by itself because other vitamins can affect the absorption. You can start at any time. If you're living in Michigan and it's wintertime and you haven't been taking vitamin D, you know that you are vitamin D deficient and you are at risk of COVID. So you can go out and get several thousand international units. Probably want to take at least 4,000 now until you get to see your doctor and get your level checked. So there's not a harm in doing that. And during the summertime, you actually show you how hard it is to absorb vitamin D. You have to be out in the sun between 12 and 2 with your limbs and your face exposed with no sunblock for you to gain the UV light. So that most people are not doing that. They're working, and most people are afraid of the sun anyways and want to use sunblock. Because we have darker skin, that protects us against cancer. And as a result, we absorb less vitamin D as well. So that even if you're covered up at all, because I had a construction worker come in who works in the sun all day long, and he had a severely depressed one because he always wears a hat and has his arms covered. So that any covering at all prevents you to have absorption. So you see how difficult it is for you to get adequate vitamin D. So if you live in the tropics and maybe go swimming in the middle of the day, you can pull it off because 15 minutes in the sun with no sunblock will usually give you around 50,000 international units, which is what we give you when we give you a high dose prescription. So if you're extremely low, your doctor should be giving you a weekly high dose prescription of vitamin D2, and for about 2 months or 3 months till you get up to where you need to be, and then you do the over the counter. But before that time, there's no problem with you getting over the counter gel caps.
Okay. Thank you. One participant said that her doctor did tell her as long as she lived in Michigan that she probably should take vitamin D.
Anywhere there's winter, you need vitamin D.
Exactly. Another question had to do with a slide you showed with a soft plaque in the artery. And you said that a stress test or an angiogram may show an open artery, but in fact, that soft plaque is still present. Can you explain how you would then detect that person was still at risk?
Well, if you have risk factors, you know you're at risk. So the key here is that if you have a group of normal tests, it means you're testing people in order to see if they need an angioplasty. That's what the tests are trying to prove. Okay. Whether the artery is constricted enough to need to do an angioplasty. And I've already said that an angioplasty is not a panacea. It is to stop symptoms. So first you're supposed to have symptoms, and then they can do a series of testing. They can do an echo stress test. They can do a nuclear stress test. They can also do something called a CAT scan angiogram, where you can actually put the dye in the arteries, in the artery to your arm, and do a CAT scan and do a very rapid CAT test. It's not like the regular CAT scans that you get for the rest of your body. It has to be a cardiac CAT scanner. And you can actually get a high quality angiogram similar to the one that you do invasively, like I showed you with the picture where you thread it up through the leg or the arm and put the catheter down into the artery. And so you can actually get a beautiful picture like that. And that will also show if you're clogged. You can also get something called a calcium score, which again involves radiation, and you can actually see if there's calcium in your arteries. And so that if you have plaque anywhere but no symptoms, then you have to be about reversing it. And that's where, if you find plaque anywhere, then you need to be on a statin to reduce your cholesterol to under 70 and get your blood pressure and your sugar under control. And so the key here is that if you have risk factors and you have a normal test, you don't go out, you don't go leave your doctor's office with your normal stress test and go off to Capitol Grill or Morton's for a steak. the key here is that you need to look at all your risk factors to make sure that your cholesterol is down, your blood pressure and your sugar and your weight, all those things. And you should be working on your risk factors. Don't just say, I don't have heart disease right now, so I can do anything that I want. You must get rid of your risk factors, because if you have any risk factors, you know you have plaque in those arteries. It's just not going to be significant.
Okay. How about vitamin D gummies? Are those effective?
I really don't know about those. The problem with vitamin D is not that easy to absorb. You can try it. Again, since we have a way of measuring it, you could take that and then measure it and then say, okay, that didn't, that's not good enough. So that's how unfortunately, we have a way to measure it. So it's not like it's something nebulous that we just hope we're doing okay. You can measure vitamin D in the blood work, and then you can determine whether what you're taking over the counter is adequate.
All right, thank you. There was a question as to whether or not you could share your slides.
You mean in terms of sending it to people?
I guess that was the question. Although there is a comment that that the presentation will be on YouTube.
Okay.
So that is an option for people to be able to see it on YouTube.
Okay.
Mm-hmm.
That's fine.
Okay. Any other questions in the chat? I don't see any at this point. Given that, we will thank you again, Dr. Davidson, for the excellent presentation. Thank you for being here. And at this time, we're actually going to have an evaluation. And my sister Alicia Eccles will be facilitating the evaluation. So thank you very much.
Good afternoon. Because your input is essential to the continuous improvement of the Greater Lansing Area Club programming, we would like to take a few moments using the polling feature to hear directly from you and get some feedback about today's program. A question will appear on the screen. You may then begin answering those questions. Again, thank you for your participation. Looks like question 3 is live now. Moving right along to question 4. Question 5 is now live. There will be giveaways. Make sure you're participating. And the final question, question number 7. Again, thank you for your participation.
Ladies and gentlemen from near and far, good afternoon. It is now time to give a few prizes away. And a $25 cash prize goes to the first person who registered for this event. And that is Victoria Wilder Cruz from Columbus, Ohio. Congratulations. For the other prizes, I'm going to present a quiz with some questions relevant to Dr. Davidson's presentation. So I hope that you were listening and taking notes as well. After I read each question, click on the chat at the bottom of your page and type in your answer. The first correct answer, actually, of each question wins the prize. Only one prize per person so that we can give others an opportunity. So let's begin. Question number 1. What did Dr. Davidson say about your waist size relevant to men and women of color? We'll give you a few seconds to get into the chat, and when I get the response, I will announce the winner. Okay, it looks like the winner of the first prize goes to Elena Hudson. And now I'm going to read question number 2. And that is, what is a normal blood pressure? The first correct response for that question is Jessica Parks. And I would like to go back to question number 1, and I understand we had a tie answer. And so Gail Kwan was also responded correctly to question number 1. Our third and final question is, what food does cholesterol come from? Okay, the third and final winner is Emma Parker. And I'd just like to say congratulations to all of our winners. Now we will handle something a little bit differently for our tie winners. Alicia is showing we're showing on the screen. All 3 prizes are blood pressure monitors. So please email your addresses to glacnbpwc@gmail.com. And our Gmail address is at the bottom of the screen so that we can have the proper information to mail or deliver your prizes. Once again, that's glacnbpwc@gmail.com. Next, I would like to again remind you of the recommended sites to review for additional information about the heart. And that's the AB Cardio cookbook. There's womenheart.org and American Heart Association, heart.org, and the Association of Black Cardiologists Incorporated. So please go out and review those important resources at your leisure. Ladies and gentlemen, today's presenter and I pray that you will utilize this wonderful information and share with your loved ones if they could not be on social media with us today. I don't want you or your family members to be like me. In 2008, I walked around for over 2 weeks with a bottle of Rolaids, thinking that I had acid reflux. And on August the 7th, discovered that I had a heart attack, resulting in a triple bypass the next day. but thank God I'm still here. So please take all of the information from the videos and everything else to heart and think about and try to relate to everything that we have presented today. Finally, on behalf of the Greater Lansing Area Club of the National Association of Negro Business and Professional Women's Clubs Incorporated, I thank each of you for participating in this important program. I also extend special appreciation to our BNP sisters for joining us today from various clubs in Michigan and Ohio. And kudos and appreciation to our producer today, Karina Eggleston. Thank you all and have an awesome, awesome afternoon.